You need to watch this if you struggle with frequent urination. Don't forget to like, comment, and subscribe to our channel for more informative videos. I don't think people understand how frequent urination can impact daily life. If you're a health-conscious individual, then you need to watch this. Initially dismissing it as stress, I soon realized the frequency and urgency of my urination were beyond normal. Frequent urination, medically termed polyuria, is defined as urinating more often than usual. While the occasional urge to urinate more frequently might not raise alarm bells, persistent changes in urinary patterns warrant attention. Imagine this. Jacob, a young professional, finds herself excusing herself from meetings more often than usual, her sleep disrupted by frequent trips to the bathroom. This scenario, relatable to many, underscores the importance of recognizing when a common bodily function transitions into a potential health concern. Recognizing the signs and understanding the potential causes of frequent urination can empower individuals to seek timely medical advice and make informed decisions about their health.
I never knew that my casual coffee drinking could be affecting my urination so much.
Frequent urination can stem from a myriad of causes, ranging from simple lifestyle choices to more complex medical conditions. One of the most common culprits is excessive fluid intake, particularly beverages with diuretic properties like coffee, tea, and alcohol. Certain foods, such as spicy dishes, citrus fruits, and those high in artificial sweeteners, can also irritate the bladder and increase urination frequency. Diabetes, a metabolic disorder characterized by high blood sugar levels, often manifests with increased thirst and frequent urination as the body attempts to flush out excess glucose. Urinary tract infections, UTIs, caused by bacterial infections in the urinary system, are another common cause, particularly in women. Benign prostatic hyperplasia, BPH, an enlargement of the prostate gland common in older men, can press on the urethra, leading to frequent and urgent urination. Medications, both prescription and over-the-counter, can also induce frequent urination as a side effect. Diuretics, commonly prescribed for high blood pressure and fluid retention, work by increasing urine output. If you experience persistent changes in your urinary patterns, it is essential to consult a healthcare professional for proper diagnosis and treatment.
Practicing pelvic floor exercises like Kegels has really helped strengthen my bladder control.
Adopting certain lifestyle modifications and proactive measures can significantly reduce the likelihood of developing frequent urination. One of the most effective strategies is to moderate fluid intake, especially in the hours leading up to bedtime. Limiting the intake of bladder irritants such as caffeine, alcohol, and acidic or spicy foods is also crucial. Maintaining a healthy weight is another important preventive measure. Regular physical activity can strengthen pelvic floor muscles, which support the bladder and urethra, improving bladder control. Pelvic floor exercises, such as Kegels, can be particularly beneficial in strengthening these muscles and reducing urinary urgency and frequency. Practicing good bathroom habits is also essential. For individuals with diabetes, proper management of blood sugar levels is paramount in preventing frequent urination. By following these preventive measures, individuals can take proactive steps to maintain a healthy urinary system and reduce the risk of developing frequent urination. Once the underlying cause is identified, treatment options can range from lifestyle modifications and behavioral therapies to medications and, in some cases, surgery. Treating frequent urination requires a multi-pronged approach that addresses the underlying cause, manages symptoms, and improves quality of life. For frequent urination caused by lifestyle factors, such as excessive fluid intake or consumption of bladder irritants, simple adjustments to daily habits can often provide significant relief. Medical treatment for frequent urination depends on the underlying cause. For UTIs, antibiotics are typically prescribed to eliminate the bacterial infection. Diabetes management, including blood sugar monitoring and medication adherence, is crucial in controlling frequent urination associated with the condition. Medications specifically targeting bladder function, such as anticholinergics and beta-3 agonists, can help relax the bladder muscle and reduce urgency and frequency. It's important to note that treatment for frequent urination is not one-size-fits-all and requires a personalized approach tailored to each individual's specific needs and health status. The journey towards understanding and managing frequent urination begins with recognizing the importance of seeking expert medical guidance.
If you experience persistent changes in your urinary patterns, it is crucial to consult a doctor or a qualified healthcare provider.
They can conduct a thorough evaluation considering your medical history, lifestyle factors, and any other symptoms you may be experiencing. Based on their assessment, they can recommend appropriate diagnostic tests, such as urine analysis, blood tests, or imaging studies, to pinpoint the underlying cause of your frequent urination. A healthcare professional can provide personalized advice and treatment options tailored to your specific needs and health status. Early detection and intervention are key to effectively managing frequent urination and preventing potential complications. Frequent urination, often accompanied by a sudden, compelling urge to urinate, known as urinary urgency, can significantly impact an individual's quality of life. Understanding the interplay between the bladder, nerves, and muscles involved in urination is crucial in comprehending the mechanisms behind these symptoms. Overactive bladder, OAB, a common condition characterized by urinary urgency, frequency, and sometimes urge incontinence, leakage of urine, is one example of such a disruption. In some cases, frequent urination and urinary urgency may be symptoms of an underlying medical condition, such as a urinary tract infection, UTI, or interstitial cystitis, IC. Seeking medical advice for proper diagnosis and treatment is crucial in managing these symptoms and improving quality of life. Lifestyle modifications play a crucial role in managing frequent urination, offering practical and effective ways to regain control over bladder habits and reduce urgency.
One of the most impactful changes involves adjusting fluid intake. While staying hydrated is essential for overall health, excessive fluid consumption, especially in the evenings, can exacerbate frequent urination. Distributing fluid intake evenly throughout the day and limiting consumption a few hours before bedtime can help regulate urine production and minimize nighttime bathroom trips. Another crucial aspect involves identifying and eliminating bladder irritants from your diet. Certain foods and beverages such as caffeine, alcohol, carbonated drinks, spicy foods, citrus fruits, and artificial sweeteners can irritate the bladder lining, increasing the urge to urinate. Engaging in regular physical activity and adopting a balanced diet can help shed those extra pounds, relieving pressure on the bladder and improving urinary control. Incorporating these simple yet effective lifestyle modifications can significantly impact bladder health and reduce frequent urination.
When lifestyle modifications alone prove insufficient in addressing frequent urination, medical interventions may be necessary to target the underlying cause and provide relief. Medications play a crucial role in managing frequent urination caused by various medical conditions. For instance, antibiotics are the cornerstone of treatment for urinary tract infections, effectively eliminating the bacterial infection causing the increased urge to urinate. In cases of overactive bladder, medications such as anticholinergics and beta-3 agonists can help relax the bladder muscles, reducing urgency and frequency. Diabetes management is paramount in controlling frequent urination associated with the condition. Proper blood sugar control through medication, diet, and exercise can significantly alleviate this symptom. For men experiencing frequent urination due to benign prostatic hyperplasia, medications like alpha blockers can help relax the muscles in the prostate and bladder neck, improving urine flow and reducing urinary frequency. It's important to note that medical interventions should always be pursued under the guidance and supervision of a qualified healthcare professional. Behavioral therapies offer a non-invasive and effective approach to managing frequent urination, particularly in cases where the underlying cause is related to bladder control issues.
One such therapy is bladder training, which involves gradually increasing the intervals between bathroom visits. This technique helps retrain the bladder to hold larger volumes of urine, reducing the frequency of urination. Pelvic floor muscle exercises, also known as Kegel exercises, are another essential component of behavioral therapy. These exercises strengthen the muscles that support the bladder and urethra, improving bladder control and reducing urinary urgency. Behavioral therapies often prove highly effective in managing frequent urination, especially when combined with lifestyle modifications and, if necessary, medical interventions.
In addition to conventional medical treatments, some individuals may find relief from frequent urination through alternative and complementary therapies. Acupuncture, an ancient Chinese practice involving the insertion of thin needles into specific points on the body, has shown some promise in reducing urinary frequency and urgency. Herbal remedies, often used in traditional medicine systems, have also been explored for their potential benefits in managing frequent urination. Yoga and meditation, practices that promote relaxation and stress reduction, may also indirectly help with frequent urination by addressing anxiety and tension that can exacerbate bladder issues. Maintaining a healthy lifestyle through regular exercise, a balanced diet, and stress management techniques can contribute to overall well-being and potentially alleviate symptoms associated with frequent urination. Always consult with a qualified healthcare professional before trying any new therapies, especially if you have underlying medical conditions or are taking medications. The journey towards effectively managing frequent urination underscores the critical importance of early detection and intervention. Ignoring persistent changes in urinary patterns can lead to a delay in diagnosis and treatment, potentially worsening the underlying condition and increasing the risk of complications. Early detection of conditions like diabetes and benign prostatic hyperplasia allows for prompt management, preventing or delaying potential complications and preserving quality of life. Early intervention provides an opportunity to explore a wider range of treatment options, potentially avoiding more invasive procedures or long-term medication use. By addressing frequent urination in its early stages, individuals can take proactive steps towards regaining control over their bladder health and preventing the condition from impacting their daily lives. Early detection, accurate diagnosis, and timely intervention are crucial steps towards effectively managing frequent urination and maintaining a healthy, fulfilling life.